My name is Ken Langa. I'm a professor of medicine at the University of Michigan, and my research has been on the epidemiology of dementia, including its economic costs and risk factors and outcomes. We've done a couple of studies on the total costs of dementia in the United States using data from the main study I work on, which is called the Health and Retirement Study. And our estimates are that having dementia adds about $50,000 per year in costs on top of what the costs of care for someone who doesn't have dementia but has all the other typical comorbidities of being older. So about half of that is just the cost of providing care, and then about another quarter is the nursing home costs or long-term care costs, and then the final quarter is the more, the things we think about as typical healthcare costs, like going to hospitals and doctors and things like that. So the Health and Retirement Study, we collect data every 2 years. So we follow about 20,000 adults in the United States who are 51 and older, and again, enroll them when they're 51, and then try to follow them every 2 years until they die. And we collect a whole bunch of different kinds of information. We do a survey where we ask people a whole bunch of questions about their health and economics and family and neighborhoods and things like that. But then we also collect, every 4 years we collect biomarker data or biological data, including some blood, and we watch people walk and get up from chairs and collect information like that. And then we also link lots of other kinds of administrative data, so things like their Social Security earnings records and their Medicare records when they become Medicare eligible at 65, so we know when they're getting health care and what kind of health care they're getting. And then we also collect information like from death certificates and that kind of information too. So these data that we collect for the Health and Retirement Study are made entirely public, so anyone can go to the HRS website and download these data. So there have been actually, up until now, more than 3,500 or so different publications using HRS data. The specific work that I do on the study has been focused on cognition and cognitive decline. We have a sort of new supplemental study to collect additional data on how people are thinking and what their spouse or informant tells us about how they're thinking and how their memory is working. So all of those new data will be available over the next few years, both for the work I do, but for everyone else, though, that will be public information too. So we're interested in trying to do a better job of understanding how people's brains are working, both here in the United States, and actually another sort of exciting part of the study is that we have collaborators in countries around the world that are doing similar kinds of studies that are patterned on the HRS. So in places like China and India and Mexico and England, the European Union and South Korea and all these other places. And they've also done, a number of those countries have also done additional data collection on cognition and dementia. So over the next 4, 5, 6 years, we'll be trying to make sense of those data and get a better understanding of how people are aging and how their brains are aging in the United States, as well as compared to all these other countries around the world.